Effective healthcare communication is essential for healthcare quality, as 30% of medical malpractice suits are attributed to communication failure, 80% of serious medical errors due to miscommunication and bidirectional communication between patients and healthcare systems. To give us more clarity on the topic, I would like to call on the stage Colonel Dr. M.P. Cariappa. Sir is a distinguished technical advisor in public health, currently associated with Delta Zulu Consultancy, Pune. With an extensive career in medical field, he has held several important positions, including serving as Director of Medical Services at the Directorate General Medical Services and as a professor at Maharashtra University of Health Sciences, India. Colonel Dr. Cariappa has also made significant contributions as an external consultant for the National Health Systems Resource Center, Government of India, and as a tech advisor for health initiatives at Tata Trust. His remarkable work has earned him numerous accolades, including a Certificate of Appreciation from Commandant Armed Forces Medical College, the Best Research Paper Award in Medical Journal, Armed Forces, and the Army Commander's Commendation for Distinguished Services, among others. Colonel Dr. Cariappa's educational qualification include Management Development Program from College of Defense Management, Secunderabad, a postgraduate diploma in maternal and child from Indira Gandhi National Open University, New Delhi, and MD in Preventive and Social Medicine from AFMC, Pune. Over to you, sir.
Thank you for the kind introduction. And ladies and gentlemen, that photograph is put on that just so you can say it's me only there. Though all that she said was all different. Thank you. So what I was invited to give a talk to you on healthcare communication as such, and I was a little bit perplexed about the audience profile that I'll be having. I was told that it is going to be a diverse audience with diverse interests from different educational backgrounds and streams. So it was a little bit of a challenge for me to figure out how would I address you all in such a manner. This is especially the pre-lunch session. The pre-lunch session is when people feel hangry and they feel slightly drowsy thinking about the lunch. So it's a little bit of a challenge, definitely, but I'll try to keep it as general and relevant to you all as possible. Please don't hesitate to note down any questions that you want to ask. Maybe at the end of the session or even subsequently, you could email me, give me drop a WhatsApp message, engage in a discussion subsequently. Because communication, if I'm talking about communication, I also should be able to communicate with you, and likewise you should be able to communicate with me. So without much ado, let's proceed further. The target, as always in public health, we begin and end with trying to find answers to these simple questions. We target these questions and hope to answer some of them. What, who, when, where, how, why. All of these are the questions that we all should be asking ourselves when we are in the healthcare field, when we interact with people. Public health is all about interacting with people. It's about the community. It is about the people of India, whom you all are a cross-sectional representative of. Health communication, you will study this in management. You will study it in various fields, mass communication. You will talk about it as a science, but it's also an art. Which is more important? Is it the science that is important, or is it the art that is important? Well, it's a balance. It's always a trade-off. It is the application of this knowledge to advance health and well-being of people and populations. It's not at the individual level alone. It's not about you and me. It's about the population that we approach, the people that we are working for or serving. We need to understand the context. Where is this coming from? We need to think, what does it mean to be a patient? All of us at some point in time have been sick, have required to seek health care. When we were children, when we have been adults, or whenever. At some stage in our life, we would have been patients ourselves. We have to think, how was it like when I was a patient? What were my expectations of the healthcare system, of a doctor when I was sick? You have to understand what it means to be a caregiver. I have been a patient myself. I was sick for some time back. I've usually stayed out of hospitals in my work and in my personal life. But I also have been a caregiver in the recent past for nearly 2 years. I looked after someone very close in my family. I looked after her for 2 years, hands-on. So I've been a caregiver. I've been a medical student, obviously, if I had done my medicine. I've been a medical student, so I'm trying to think from that lens as a medical student. I am a healthcare professional, and I have been a patient's relative. My parents have not been well at times. My relatives have not been well. All of us are in the same boat. We know someone or the other in our own lives who we have to think about from their point of view. It's not about when we are healthy and well, we don't think of health. It's like when you have money in your bank, you don't think about money at all. When you don't have money and you go to pay that credit card bill, that's when you think about money. Who will do all of this communication? Who? It is you. It is me. It is us. There is no them in this thing. Someone else will do it. All of those who are involved in health, it is incumbent upon all of us, whether you're a doctor, whether you're a medical administrator, a healthcare administrator, a pharmacist, a laboratory technician, a nurse, anyone in the healthcare system who is dealing with people, with patients, has to know about communication, because that's what you're there for. Healthcare providers also, the communities. We all have a responsibility to our community. What is a community? A community is where we all are living in. It is the building that we live in, the village that we stay in, the suburb that we live in. That is our community. People, populations, as young people, those of you who are still young or finding your career paths, you might not think of populations right now. But eventually, if you ask your senior colleagues, you will find out that the more senior or older you get in a system, your responsibilities increase, your scope of thinking increases, or it should increase. You need to move beyond individuals to start thinking of people, the bigger picture. The context again, where does all this communication occur? Where? So I'm not a clinician myself, but I have practiced medicine for the first 5 years of my career. I handled patients, I dealt with emergencies, I looked at all of the clinical aspects of medicine. But to update with what it was, I had a group discussion with my colleagues who are clinicians. I asked them to tell me the settings that they would be in. Usually, I conduct healthcare communication as a short workshop for depending on the target audience. But I'm not here to conduct a workshop. I'm just here to give you a teaser. I mean, I won't even compare it with Salman Khan's new film because the reviews are mixed. So we'll just think of it as a trailer, a teaser for what is there. No comparison with Salman Khan. We've got inpatient department where this communication can happen, where you've got ward rounds, nursing rounds, handovers. The most crucial part, when one shift is turning over to the next shift, the handover that has to occur. Teaching rounds, in a medical college system, teaching rounds occur. You've got the outpatient department where all these interactions are taking place. The patient and his relatives or her relatives are at the center of it all. The patient and the caregiver. Patient's attendants, housekeeping staff, you're interacting with them, you're interacting with the nutrition services, the dietary services, you're interacting with the duty doctors, the pharmacists, the specialists, the nurses. This is the interaction that's happening and the setting I've already told you about. Do the theories matter? Now, if you look at it, the theory does matter. For example, now, you see the background. The background is a orangish yellow, which is not sort of good for the setting that we are in. But there was an insistence that we use this background. So I had no choice. Otherwise, I had chosen a darker background to do it. But this is what I'm saying. Theory does matter because there is theory and science of presentation. It should have been paid attention to. So I'm just pointing out that there are gray areas in everything. We have to apply our own minds to it. So I just complied with what were the requirements given the short notice. Theory does make a difference. You can't endogenously come up with something. Theories help guide you into the action that you require to take. You need to broadly understand, this is a very simplistic model in health communication. Sender, receiver. You send something, the person decodes it, understands it, and you get feedback back. Very simplistic. There are many theories that as a student you need to understand. You understand these theories because you decide which one do you want to adopt in your practice. Which one do you want to internalize, or which combination of theories you want to internalize? Eventually, theory is of no use if you can't apply it practically. All that you read and study in your textbooks and what your teachers tell you and impart to you and practical people discuss with you, it's of no use if you can't adapt, adjust, improvise, and eventually overcome the problem that you're faced. And this is from the US Marine Corps. This is what their mottos are: adapt, adjust, improvise, and overcome. Effective healthcare communication, that's what we're talking about. Just communicating is of no use if it is not effective. You want to do something that is effective. So you need to make sure that you do whatever is required by following certain broad parameters. Communication can save lives in handovers, in emergency rooms, in clinical settings. Communication that is proper and appropriate can save lives. Communication can improve trust in healthcare providers, which is very important in the modern times. There is a major lack of trust in the healthcare system today. We all are aware of that as individuals. Though we are a part of it, we might not take cognizance of it, but we should acknowledge that there is a deficit of trust in the healthcare system. What are we going to do about it? Not a part of the scope of this talk of mine today. Communication can spark community action, which is ultimately what we want. We do not want just individuals to change what their behaviors are. We don't want just individuals. We don't want that young lady sitting there in the corner to be living a healthy life. We want all of you to live healthy lives, or the majority of you to live healthy lives, so that you'll have less disease. So, communication, if it's effective, it will bring about community action. The principles for effective communication. This is from the WHO. These things keep evolving. Each decade you come up with a new matrix. You come up with new fancy graphs. They all are the same variation. Ultimately, it's talking about being accessible. Any communication that you make should be accessible to everyone, to all people that you're focusing on, irrespective of their ability to use a smartphone or their socioeconomic status. Accessibility. You need to have, there is no point telling someone, live a healthy life. For example, I used to tell this to my undergraduate students. When you go to a slum area and you're advising an overweight lady who's staying in a slum there कि आपको वजन कम करना अपना, आप थोड़ा शाम को walk कीजिए. Is that appropriate to tell her? Is it actionable by her? Where will she walk? Is there a facility for her to walk? Is there space for her to walk? You have to give advice that is actionable. You can't tell school children, eat balanced diet. What is a balanced diet? What will they follow? You have to be practical in what you're saying. So when I was a young captain, one senior officer of mine told me, he says, young man, if you're going to tell me bullshit, I'm going to treat it exactly like bullshit. So we have to be careful about what we tell our clientele, which comes down to credibility. Credibility. So for example, if I am here, I've got a stage, I've got a mic, and I start cracking jokes here. Am I here for a stand-up comic session, or am I here to communicate with you about healthcare communication? Credibility. If I was a stand-up comic, yes, I would have done that, but I'm not a stand-up comic. Because I have tried to maintain homogeneous credibility in what I do. So I only do what I do. You as healthcare professionals have a public persona which you have to maintain. In private, you can do what you want. But for younger people, just be careful of those selfies taken in all awkward circumstances. It might come back later, 10 years down the line, when you're a respectable healthcare professional, that might come back to you, to haunt you. Social media will never let you forget. Credibility. Any information that we give must be credible. It should not be, मैंने WhatsApp में पढ़ा था, or it came on Facebook today. That's why I'm talking about this. Social media is not referenceable. In a scientific article, you cannot quote Wikipedia. A lot of young researchers like to quote Wikipedia. You cannot please quote Wikipedia. Relevant. If I'm going to talk to you in this month of April, I'm going to say, when the weather is cold, we need to take precautions to keep warm. Is it relevant? Is it relevant to the heat that we are facing? So we have to be careful about that. We have to cry wolf at the correct time when we see a wolf. Not that there is no wolf and we say, oh, that sheep, that looks like a wolf, 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 wolf. We have to be relevant to what it is, and obviously timely is linked to that. I will be illustrating that with an example when we talk about the COVID-19 campaign that we had organized. Anything that we as healthcare professionals communicate to our people, to our clientele, it must be understandable. Should not use jargon. Healthcare professionals love to use jargon. And this all started off with Sanskrit, with Latin. You wanted to make as esoteric as possible, as difficult to understand for the common man as possible. If you make it easy to understand, then what is the use of you all? So we need to keep things simple. Keeping it simple is the most important thing. Different principles that we have for effective healthcare communication, which comes down to the C word. This C word is crucial. Just like there we've got a young couple who are getting married. In marriage, the C word is crucial, which is commitment and communication. Same way, in the healthcare profession, you need to be committed. You need to communicate. As crucial as it's in a marriage. You are married to your profession. You are married to your clientele. So what I'm encouraging all of us to do, bring about a sea change. Each person who talks about this has a list of C's. This is my list of C's. These bubbles that you see are communication. You can fill them with anything that you want. Two people talking to each other, communicating with each other, are exchanging bubbles of thoughts. Fill in blank whatever you want. It's up to you. Whatever you do, you must have content. That means you must know what you're talking about. So for example, I will not stand here on stage and talk to an audience of neurosurgeons or of automobile engineers about their specialty, about their work, because I do not know that stuff. I do not know their content. You must step into only those areas where you are knowledgeable about. Content must be good. You must believe in what you say. You must have conviction. You must have confidence. You must have contact. So, I can stand looking here, I can hide behind a podium, I can skulk, but I need to be able to talk to you, to communicate with you. I need to be open towards you. Confidence. I need to have conflict. Now, if I just keep on going like this, you'll all keep nodding your head and agreeing with me. You need to have a little pushback. You need to be able to question, why is he saying this? I don't agree with him. So I need to be able to create a little bit of resistance from you to certain ideas. If everything is smooth sailing, it won't work that easily. And healthcare professionals must always be cool. A lot of people, young professionals, always ask, when we have people coming to beat us, patients, relatives coming to beat us, how can we be cool? I say, yes, you can be cool. You can keep a towel to wipe the sweat when you're running away. You can still be cool. Health education is what we are looking at by communicating. We are educating. All of us are educating someone or the other. Health education is a process. It's not a one-off effort. It's not putting up a poster or sending out an SMS or sending out a WhatsApp message. It's a process that aims at encouraging. It aims at encouraging people to want to be healthy, to know how to stay healthy, to do what they can individually and collectively. To maintain health, each of these words that I've highlighted in green here, or whatever this color looks like to you, each of these words is specifically an action-oriented word. And where is this from? The Alma-Ata Declaration, 1978. Anyone can just remember or recollect what was this declaration about? 3 words. Okay. Anything else? Health for all by the year 2000. 2000 is past. It may have been ideal, but it was something I always tell people, if you want to climb Mount Everest, at least you should buy a train ticket till Dehradun Otherwise, you will still be in Pune. You might want to climb Everest, but you will not reach anywhere. So this is utopian, but it is still very relevant. Coming down to, does anyone know the full form of IMG? Those who are in the medical college here, the faculty would all know about it, obviously. Yes, ma'am? Yes, Indian medical graduate. And there's a young people phrase that says, OMG. But this IMG is what we will use. This IMG is inform, motivate, guide. Any healthcare communication that we indulge in, if it is not informing someone about something, and if it is not motivating someone about something, and if it is not guiding someone into how to do it, it's of no use. So just as you say, oh my God, you must practice IMG. I'll illustrate it with an example subsequently. This IMG is required to adopt and maintain healthy practices and lifestyles. Just telling someone, for example, I tell you all, it is important to get enough exercise every day. What has that done? It has informed you. But has it motivated you? So if I say, it is important for you to get enough exercise every day because it will keep your heart healthy, it will make your skin look younger, you will feel full of vitality. Hopefully that might motivate you a little bit. But has it guided you into action? So still one part is missing, G. So what do? I say inform. I give you the information, I give you the motivation component, and I say every morning or evening, try to walk at a moderate pace for 30 minutes. I'm giving you actionable input. So I have informed you, I have tried to motivate you, I have guided you. Now if we were a Hindi picture, we would say even the police stations also, they will motivate you very well. When they catch criminals, they will give a few air kisses and then they will say you are motivated to give up crime. So what I'm saying is IMG is what we need to internalize when we're talking about healthcare communication. While we're talking about this, all of us need to understand 5 key facts about human behavior. Now, why is this magic word 5? Why do we always think of a 5 number? Why am I saying 5? Because I've got the remote in one hand and I can only say 5 like this. I can't do like this, no? So 5. 5 is easy for us to remember. So 5 is always the slap that our mother used to give us. 5. So 5 keys to remember. First, people. When I say people means all of us. We give meaning to whatever we are told based on the context we are in. So the key word here is context. What context we are in. Telling a person stepping out from a Mercedes that you need to be careful about where you keep your feet because there is going to be slush outside. It's not going to be contextual for him because he's not going to come to such an area. Culture and social networks, they influence people's behavior. You all obviously understand this. Where you are from, the people you hang out with, your friend circle, your social circle, it influences what your behavior is. As young students, those who are young here will understand that. The groups you hang out with. If everyone is studying, you will study. If everyone is doing matar gasti, you will also do the same. We used to have this thing when we were young. Our parents would tell us the sangati. You tell me who your friends are and I'll tell you who you are. Now it may not be so relevant because your friends are online also. The third key fact you need to understand is people cannot always control the issues that determine behavior. So, for example, if some of you smoke, smoking is not good, there should be a small advertisement here that cigarette smoking kills. So, if cigarette smoking is not good, tobacco consumption in any form is not good for your health and for others' health. Now, if you are a group of 5 friends and you don't personally smoke, but the other 4 friends smoke, you may not smoke, but you're sitting with them exposed to the same. Now either you step away or you can't do it each time. So you are stuck. You cannot control the issues that determine behavior. Sometimes there are things outside. Coming to Lovely, if there's a lot of traffic on the road, you can't help it. Because it's beyond your control. Google Maps may tell you 23 minutes. But does Google Maps know that there will be a buffalo which will come and sit down in the middle of the road? So, you cannot control. So, you must understand that your patients not necessarily can control. People's decisions about health and well-being compete with other priorities. You may tell a young mother कि आप पौष्टिक खाना खाओ, दूध ज़्यादा पीना. She would rather, if the mother is poor, she would rather give it to her child than have it herself. Because her health is competing with her child's health. She will obviously give it to the child. People often make decisions based on emotional factors and not on logic. If you think logic would work, there are so many things that we all do not do. We know it. We know we should not do it, or we should do it, but we don't do it. As simple as that. So these are the 5 key facts. Very simplistic, but just to give you an overview that this is where theory also comes in. This is where practical experience also comes in. This is where science comes in. Effective healthcare communication. So, healthcare professionals. Healthcare professionals is a generic term. Healthcare professionals should become competent by listening effectively, eliciting information, counseling and educating patients, making informed decisions on patient care. Let's just think of it superficially. Ultimately, bottom line is all healthcare professionals must undertake active listening. Half of healthcare is just listening to a patient. That's all that the patient needs. Inside a ward, in the OPDs, in real life, when you've got your chacha and masi who are coming and asking you something, they just want to be heard. They just want someone to listen to them. You can help them just a little bit. Body language is very important. Healthcare professionals must understand that their body language affects the patient communication spectrum. Positive body language, negative body language. I will illustrate it with an example. So when a patient is coming into your OPD and you're sitting there if you are looking at your computer screen or you're looking at your phone and you keep on saying yeah, and at the same time you're doing something on your phone. That's your body language. It's like when you are driving a scooter or driving a car and you find people are looking at their phone and doing it. How are they doing it? Don't ask me. Same roads even I drive. I am looking at the road and still I'm scared of looking at anywhere else. Same way, the road doesn't care, but the patient cares. So body language also means no screen times, don't take phone calls. हाँ मैं एक phone call लेता हूँ, and you're talking, you turn the other way. Patient ignore हो गया. Yeah. Okay, so I've got 10 minutes left. Good. Now this is very effective communication. I can't misunderstand it at all. There are just 10 minutes written on that parcha. 10 minutes. In bold letters, which I can read even with my non-reading glasses. Effective communication. Body language prescription. There are so many things we can think of. I'll give you an example. I was at a university doing a fellowship. This was in 2005. A reporter asked one of the faculty members, this was 2005, was before pre-exposure prophylaxis for HIV came about. So the reporter asked that doctor, he said, doctor, what do you think about, will there be a point in time where we'll be able to take tablets to prevent HIV from affecting us? So then the doctor went, he stood like this in the corner, and he spoke for the next 1 hour on what he thought about it, all the time looking down like this. Whereas all that reporter wanted to know, yes, no, or some bite, 1 minute of something, because that's all the reporter wanted to know. What is the body language? He was on the defensive. He was skulking around. He himself was not clear about what he was talking, but he had so much of knowledge, he had to pour it out. Body language makes a lot of difference. Health risk communication is a public health paradigm. All of us here have a duty to counter disinformation. It's going to be the next pandemic is going to be disinformation. WhatsApp university, social media university is what we have to deal with. Every day I have a call with my mother and we have this talk about WhatsApp. Don't believe it. Don't believe it. That's all I'm doing. And with my mother, it's an extended circle of her friends. They will say, you know, that one was saying that this has come out like this. Then I say, okay, mother, WhatsApp University needs to be countered with credible information, correct information. Know your facts. And that can start with all of us here, not forwarding messages without checking them. Think, check, do not forward. Do not forward. Why do you need to forward something? There are enough people already doing it. So to get back to examples, March, April 2020, just when we did that Tali beating and we got locked down. I mean, if we had known today that you beat a Tali and next day going to be locked down, no one will beat a Tali. So when this lockdown occurred, in the first 10 days, we realized that now everyone is stuck at home. I was advising Tata Trust on their approach to it. And they asked me, can we run a campaign to give people correct information? Because you all would remember, March 2020, no one knew anything other than China says something has come. It's a virus. How does it spread? No one knows. How, what it does, no one knows. So we launched this campaign in 2020, March, April, around about 25th of March. And this was a pan-India campaign launched by Tata Trust across the Tata Group, plus intended to reach out to the community wherever they worked. We had 278, it was done entirely online. We devised the material for it. Entirely online, 278 master trainers, covered nearly 10,000 villages in 21 states and reached about 21 million people. And also by a network effect, probably many more. Now, what I'm illustrating here, ladies and gentlemen, is that healthcare communication doesn't require massive funding. It just requires correct ideas. It requires credible information. It requires us to follow basic, simple stuff. Look at this. April 2020. 5 key messages. Was this access? This was translated into 22 different languages. Just these simple key messages with IMG format. Inform people, motivate them, why should they do it? Guide them into action. Just these 5 messages. Was it actionable? Was it credible? Was it relevant? Was it timely? Was it understandable? It's a published article in a journal, International Journal of Health Education. So you can see the methodology that was done in doing this thing. In 2021, the next wave when it came about, we did the same thing. 5 key messages to halt the pandemic. 5, the one hand I told you about, but we said we need to add on something more. Plus 2 key messages to empower the community to work against stigma. Because stigma is an important thing. उसको वैक्सीन नहीं लिया उसने, दूर रहो उससे. उनको कोविड हो गया, दूर रहो उनसे. Don't stigmatize was our main thing. Normalize it. And the last key message was vaccinate. Don't hesitate, vaccinate. You ask me today, I'm not going to talk about this now. This is the posters we did. This is the messaging in English. We did it all, translated into 22 different languages. Look at this, April 2023, today. Now we changed it, removed COVID-19 and calling it acute respiratory infections. All acute respiratory infections. Is there anything different from what we did in 2020? So it stood the test of time because we were credible. We had a correct scientific pool of people who thought about what is the messaging to be done, who didn't do knee-jerk. If you remember in April, May 2020, we were happily spraying everyone, buckets of water, spray tunnels, disinfection chambers, scooters would drive through, cars were being sprayed. What nonsense. As public health professionals, a lot of us campaigned. We wrote letters to the editor, we wrote to the Prime Minister, we said that this needs to be discontinued. In the DY Particle Journal of the Medical College, we published an article also on this disinfection. To spray or not? That is the question. To spray or not? Who decided that we should spray? Spray kar do. You got bad attendance? Spray kar do. So what can a busy healthcare professional do? All of us will eventually join the working field someday. Fine-tune a personal technique of imparting health education to your patients. Understand IMG. Adopt a combination of approaches. and understand how behavior change occurs. Behavior change doesn't occur just by telling someone. If someone told you something, your parents would have made you very successful. They told you something, you did it, and it happened. It doesn't happen that way in life. What should a healthcare professional do? Be aware of developments and trends from patient's perspective. Read what a patient is reading. Go on Google yourself. Be seasonal. Understand what a patient's doubts are. Talk to patients. Understand their perspectives. Be organized. Use approaches like gather. Gather is greet, ask, tell, help, explain, return. It's a technique used in family planning. Active listening. Seek to understand the patient's concern and, of course, communicate. Do healthcare providers, professionals actually provide, yes, last 2 minutes. Do healthcare providers, professionals in your hospital system here, those who are in the faculty here, do you have the time, which is a common excuse we use, I don't have the time. But are you what you're telling your patient, is it informing? Is it motivating? Is it guiding? Typical examples would be to reduce consumption of alcohol, to stop consumption of tobacco. See, it is reduce, it is stop, both different words. To consume balanced diet, to get adequate exercise. 95% of doctors, this is the broad advice we give to our patients. 95% of doctors. But will behaviors change just by putting up posters? By giving patient info sheets? By having a treatment counselor? Will it change, actually? Or is it just information we're giving? Till we add on motivation and guidance, it's not going to change. To give you an example, look at this bucket of inform, motivate, guide. Keeping an open mind, all of you, that is the most important thing. Keep an open mind. Inform the patient, then motivate. What's in it for this audience? What's in it for this audience to sit here and listen to me? You've been here with me 40 minutes plus already. 2 minutes left still. The person, the family, the community, what's in it for them? Why should they change a behavior? Guide the patient. How to implement simple prevention steps. IMG. And what can a healthcare administrator do? Those of you who are getting into administration, healthcare administration, look at this. Firstly, understand that healthcare communication is complex. Understand that healthcare professionals need your support from the administration to implement anything for patients. And understand that merely displaying posters is not enough. You have to believe that you want to help your patients. A combination of approaches is what we recommend. A combination. Customized, it has to be customized to your hospital setting. And most important, lastly, what a patient should do. All of us, like I said, are patients. What should a patient do? A patient is the other side of the equation, whom we are all there to serve. A patient must have a relationship that is a very personal one, which is built on communication and trust. So a patient must be organized, must keep good records. Don't fold those case notes and keep it. Itna look like literally like a stamp size. Fold karke, fold karke, fold karke. Keep it unfolded. Set the tone. Be assertive without being offensive. Young people have a tendency. Doctor, Google says this. My wife was a medical specialist. She would say, people come to me with printouts as if they can read Google printouts from there. Now, if you're coming to me, don't talk to me about Dr. Google. Dr. Google, you can take treatment from Dr. Google. Be assertive without being offensive. Patients should not hesitate to ask questions, but ask questions correctly. Don't say, I don't agree with you, doctor, this is wrong. Most importantly, at the end of it all, we must first seek to understand our patients, our clientele, our populations, our people. And then only should we seek to be understood ourselves. This is from the 7 Habits of Highly Effective People. I call it 7 Habits of Highly Effective Healthcare Professionals also. Seek first to understand and then to be understood. But there are circumstances and situations. This is Tiger Hill in the Dras sector, just immediately after the Kargil war. Now here you're not seeking to understand why this guy is there, the Pakistani chap. You still need to deal with it. In healthcare, irrespective of what the patient may want or not want, it's our duty to communicate with them. We have to do whatever is required to be done, but we must do it scientifically. We must do it with commitment. You can make a difference, all of you sitting here. Today, tomorrow, every day, you can be communicators, you can communicate. You can be the change that you want to see yourself. Communicate. So I have finished, ladies and gentlemen.
I could see smiling faces in the audience throughout the session. So it's needless to say the session was very interesting and engaging. Thank you, sir, for throwing light on the nuances of healthcare communication and for leaving us healthcare and hospital administrators with the advice as well. With that, we can take one question from the audience.
Hello, sir. My name is Prachi. I'm myself a healthcare professional. Healthcare communication professional, I'm sorry. So often we face challenges in determining the success matrix for our clients who are pharma companies into what were the determined factors that qualified for a successful disease awareness campaign. So if I can ask you, according to you, what would be certain criterias that you qualify as a successful healthcare disease awareness campaign?
Okay, so Prachi, thank you for that question. It's a very thought-provoking question, and coming from the industry perspective, when you look at disease awareness campaigns, let's say right now we're in the month of April, we are looking at heat. So we want to prevent heat stress from happening, and we're running a campaign on, say, heat stress prevention. What can you do? You can inform about what's the current heat stress that is going on. We can say, motivate people, that you tell them, see, if you fall sick with heat stress or heat stroke, you will be in hospital, you'll have to pay more hospital's bills, you'll miss your work, you might even die with heat stroke. Motivating them. And if you die, then who'll look after your children, who'll pay the fees for them? Motivating them. Guide them into action. G, I-M-G. Guide them into action by telling them, drink shikanji, drink water, don't go out between 12 o'clock to 5 o'clock. If you're going out, wear a hat, carry an umbrella. You might tell them, guide them into action. But we are human beings. Will we listen? This is the problem that I have with metrics. Metrics are very important to study because it tells you what you've done. But can you change behavior by just running a one-off campaign? That is my point. So what I always advise companies who ask me this question, I tell them, look at what you are putting in. Look at the inputs. Look at the outputs. Don't look at outcomes. You say, okay, we conducted these many talks. We distributed these many pamphlets, sent these many messages, displayed so many posters, handed out so many free samples. But can you change people's behavior? Now, how many of you here carry an umbrella when you walk around in the sun? How many? Okay, very few. How many men will wear a hat? We don't. I've got a hat in my car, but I wear it only when I'm playing outdoors. So what I'm saying is, these things, does it impact? That's the problem with healthcare. Everything is abstract. Nothing is concrete. So I'm going to tell you all of you, I'll request you all, please get 30 minutes of moderate level exercise every morning for the next 1 month. After 1 month, ask yourselves how many of you did it. You're professionals. So I have got my metrics done. I have told you. Tick mark. Any other questions? You can always address it on email to me or WhatsApp to me. I'll be glad to engage with you all, or I'm there on LinkedIn also.
Hello,
no
sir.
issues at all.
One more question.
Sir.
I come from medical background, sir. I'm a gastroenterologist.
Excuse me, sir.
Yeah, we
Thank
can
you.
take this last question.
Okay, if you say.
The basic issue is the frontline thing regarding the communication. We, the doctors, come first. So do you advocate a subject in healthcare communication in the MBBS curriculum?
Absolutely. Thank you for bringing that point out. Since 2011, there have been a few efforts being made at medical college level to introduce it as undergraduate curriculum. And in 2014, MUHS came out with their own healthcare communication module for students, undergraduate students. And 2018, the erstwhile MCI and now the NMC, in 2018, they released the ATCOM, Attitudes, Ethics and Communication modules across the MBBS spectrum. It's been very clearly demarcated. Now, I do not know whether it's being practiced on ground in the medical college or not. So if it is being done. It is part of the curriculum now. Because there are different vignettes, there are case scenarios talking about how to break news also, dealing with different situations in healthcare system for medical students to be aware. So maybe what should be done, what I'm understanding is, for mid-level doctors who missed this in their undergraduate days, maybe we need to do that also. Maybe we could organize this kind of a workshop. Because ultimately, what is a workshop? It is orienting you, sensitizing you, creating an opportunity for you to think of a cogent response. Of how will you deal with it when you are handling that? That's what we practice. So it's, I think, for the symbiosis to take cognizance of that you could organize such a workshop for your mid-level and junior doctors who have missed out on this EdCom module of the NMC curriculum. Thank you.
Now I would request Samita Jadhav, Director, Dr. Samita Jadhav, Director, Symbiosis Institute of Health Sciences, to felicitate Colonel Dr. M.P. Cariappa, sir.